Here at Fox 13, we're teaming up with the folks from IASIS Healthcare to help raise awareness about overall health. And today, we're talking about how to have a healthy heart. Dan is over in the Fox 13 phone bank with Dr. Christopher Kim, and we're discussing the link between obesity and heart disease. Right, Dan?
Exactly, because there is a link between obesity and heart disease. And what are those links, Dr. Kim?
Well, obesity, generally speaking, is one of the main risk factors for coronary artery disease or blockages that develop in the heart. And in our country, unfortunately, obesity is on the rise.
And so what is the link? I mean, how does that work?
Well, obesity predisposes to diabetes. And in terms of diabetes, we consider them to have coronary artery disease from the get-go. The other thing is obesity lends to a sedentary lifestyle. People don't exercise. And all those things kind of contribute to poor health in general.
And do we worry about the arteries, though? I mean, directly related to obesity? I mean, are there things that we're eating that are lining our arteries, that kind of thing?
Most definitely. I mean, a high-fat diet, high-sugar diet, those things are extremely toxic to the arteries and predisposed to plaque buildup and blockages and just badness overall.
So we know that it's not good, but what are the specific risks there?
Well, with obesity, any type of risk that increases your chance of plaque buildup, obviously you can have a heart attack, you can have blockages build up in the legs, and causing leg pain, just everything, stroke.
And the big problem with this, from what I've read, is once you have it, it's really hard to reverse it. I mean, there isn't much you can do. You're living with it.
Yeah, I tell all my patients, we all have blockages building up. It's just a matter of how much. And once it starts the process, really what you need to do is we need to slow it down or help pause the progression of disease.
So what do we do about it? How do we live with it?
Well, everything in moderation. We need to cut back our fats. We need to cut back our sugars. We need to exercise. All the things that we should be doing anyway, and it's just more important that we emphasize that.
And that's exactly what this guy's done. You can see him right here on the monitor. Big Buddha has really cut back. He's made some big changes in his own life. So when we make those changes, we can't really stop the damage we've already done, but we stop the progression, right?
Correct. We stop progression. We also condition the heart to be able to resist damage. And so really, it's all about protecting the heart and protecting the vessels and, again, stopping progression.
All right, if you want to stop right now and ask some questions to these very intelligent individuals like Dr. Kim behind me at the phone bank, all you have to do is call this number on your screen. It's 844-744-3258. They're here until 6 p.m. taking your calls all day long.
All day long.
Thanks, Dr. Kim. Appreciate it. Carrie.
Thanks, Dan.